Hello, 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 and welcome to Q&A with Q. I'm Quisha Umemba, registered nurse and public health consultant, and in this episode, I'm answering a question that I get asked quite a bit, and that is, Quisha, should I get a master's of science in nursing with a public health concentration, or just go ahead and get a master's in public health? And this question that I get asked all the time comes at a great time as I just co-hosted the Nurse Entrepreneur Summit and spoke about the possibilities in public health consulting. So if you want to know my take on the difference between the two degrees and which one I think you should choose, stay tuned for more. Welcome back. So as I mentioned in the introduction, I just had the opportunity to co-host the Nurse Entrepreneurs Summit with a good friend of mine, Nina Hart of Hart Healthcare Solutions. She's a registered nurse. Her specialty is post-acute care. And the summit was amazing. I'm still coming down off the high of all of the gems and lessons learned and strategy and mindset work and just all of the boss moves that nurses in business and nurse entrepreneurs are making. And I was really excited that I was able to bring something to that summit that no other nurse, especially no other nurse that I know of right now, is able to do. And that is my expertise as a public health consultant. And so as I was thinking this weekend, I really didn't plan on answering this question this early into the episodes. I thought this would be the perfect opportunity to go ahead and get that question out of the way. I do plan on doing another video about the possibilities in public health consulting. So if you've not subscribed to the YouTube channel, go ahead, like, share, subscribe, click the little bell for notifications. So if that's an area that you're interested in, you know when I release that video, and share with you other events, workshops, courses, etc. that also will provide you with more information on public health consulting, especially getting started, because there's really no blueprint for people that are wanting to get started into doing public health consulting, the type of consulting that I do. So with that being said, let me first talk about my journey, why I decided to get a master's in public health as opposed to a master's of science in nursing. And it was really one main goal, or two main reasons rather. One, I didn't think that I need a third nursing degree. I have an associate's in nursing. I have a bachelor's in nursing. And if you know anything about the nursing field, the degree is only as good as your license. And not to think that I would ever do anything where my license would be revoked, but you never can tell. And I didn't want to have 3 degrees that would render basically useless if something happened and I lost my nursing license. So me being the backup plan A, plan B, plan C type of person and personality that I have, it was really important for me to have a master's degree that I could fall back on if A, I did lose my nursing license or something happened to it, or B, I decided that I no longer wanted to do the type of nursing that I was doing, which is exactly what happened. I fell in love with public health, and I found out that it complemented my nursing background perfectly. So I'm a really big advocate of public health and public health degrees, and encouraging nurses to get involved, because a lot of times nurses don't know exactly how they can utilize it as it goes so well with their skill set. So first, let's talk about the master's in public health, and then we'll talk a little bit about a master's of science of nursing in a public health concentration. And I will give you a disclaimer, I don't have an MSN, so I'm just gonna give you information that I've either heard from others or that I have researched. So let's get started. So I wanna start first talking about getting a master's degree in public health, or a degree in public health in general. And I've got some notes here on my screen that I want to pull up to make sure that I don't forget anything, because it is quite a bit. Public health is one of those degrees, very much like nursing, where you can do a number of things. You can go into a number of different fields with your degree, but I think there's a higher possibility, or a broader pool of career opportunities for people that go into public health degrees. And so there are over 20 major fields of study in public health, but there are 5 core disciplines. And so the first is health behavior, health education, which is exactly what I decided to concentrate in for my master's of public health. I went to the University of Arkansas for medical sciences, and I have a master's of public health with a concentration, a focus, or an emphasis in health behavior, health education. And what really resonated with me with this particular degree path is that it had a focus on planning, implementation, management, and evaluation. And so if I was not a nurse in a previous life or in another life, I would be an event planner. Anything that has to do with planning, timelines, deadlines, deliverables, even though it sounds really nerdy and it sounds kind of stuffy, that's just how my brain is really analytical like that, and really set to deliver and work based on timelines and deadlines. And so for me, that went really well with my love for adult learning and education, and what I did as a nurse educator, specifically a certified diabetes educator, which I was doing right before I started my master's. Additionally, you can go into biostatistics. God, I hated that. That's really the branch of statistics that just deals with life in general. And people that work in biostatistics, they really help answer pressing questions in medicine and biology and public health and other branches of healthcare, like, looking at how drugs work, looking at what causes cancer and other diseases, looking at how certain people with a certain illness are likely to live longer than others. So lots of math, lots of science. If you love that type of thing, then this may be your area when it comes to public health. The third branch is epidemiology. And so you probably, if you are not aware of epidemiology, an epidemiologist, I can say that, you probably got introduced to them during COVID-19, because this is a branch of medicine that really deals with the incidence and the distribution and possible control of disease and other factors that relate to health. And so a lot of times you'll hear these individuals called disease detectives, because they do investigate health causes and outbreaks and pandemics and things like that. And so I thought I wanted to be an epidemiologist. I remember being a little girl watching the monkey, the outbreak monkey on the movie Outbreak, and thought, that's me. I'm going to save people from outbreaks and diseases. And once I kind of learned what all was involved in it, it really just kind of didn't gel well with where I saw myself working in the future, like health behavior and health education did. Fourth is environmental health. I think that goes without saying what that is. That's the kind of the focus of environmental health. Is really looking at the relationship between people and their environments, right? And so you see people that work in this area, they're doing more of the restaurant inspection and collecting water samples and making sure that there's not too much pollution in the air, and anything that's relating to our environment deals with environmental health. And then last is health policy and management. And that's exactly what it is. The administrative side of public health. It's making sure that certain laws are passed. It's advocating for certain programs and initiatives and things like that to be put in place. So there's a lot of writing, there's a lot of research that's involved with that. Now, those are the 5 disciplines of public health, and I could go a little bit deeper into that, but I won't. What I'd like for you to understand, if you're watching this video and trying to figure out the difference between the MPH and MSN, I just want you to see what's available to you with a Master of Public Health degree. Now, that list is not inclusive depending on the school you go to. There may be a concentration on global health. There may be concentrations on other things that my mind is not thinking of right now. There's so many different choices that you can choose if you do want to go. The one thing I will say about getting a master's in public health, the possibilities are limitless. The sky really is the limit. Again, I think both the MSN and the NPH really open your career up, of course, for advancement and more money, but you will not have, okay, if you're listening and this is the one thing you've been kind of deciding on which one you want to choose, you'll have a lot more opportunity as far as the types of jobs you can do, the types of organizations where you can be employed, and how high you will go with a Master's of Public Health, which may be a little bit more limited with the MSN in Public Health. And I'm going to talk about that next. So when we're talking about a Master of Science in Nursing, it's a graduate degree, just like the Master in Public Health. And it does give you the knowledge and the skills necessary to practice nursing at an advanced level. Now, did you get what I said? To practice nursing at an advanced level. And just like an MPH, just like many master's degrees, you can still concentrate or have one area that you specialize in. This is not any different. I will tell you why I did not go to get a nursing degree, or a MSN rather. And again, I said, one, I wanted to have a backup plan, right? Two, I wanted something in the event that I no longer wanted to do nursing. But the third reason is, at the time, several years ago, about 8 years ago, when I got my MPH, I did look at an MSN. I did look at getting a master's degree. And I was told at the time that basically the opportunities afforded to me would be teaching or administration. Administration, of course, I went on to do several administrative or programmatic type positions, but teaching nursing students was never something that I wanted to do. It's never been a goal of mine. It's never been something I aspire to. Teaching, yes. Teaching adults, teaching the public health workforce, absolutely. But teaching nursing students, no. And it's just because I'm a do as I say, not as I do type of person. I still believe in the 3-second rule. So if I'm teaching students in a clinical environment and something drops on the floor, if it wasn't there for 3 seconds, it's good. Like, I would be the worst instructor for nursing students. So I knew it was nothing that I wanted to do. So that is why I decided not to go. But however, if you are someone that is considering, you want to be in MSN, you want to teach nursing students, you want to be in middle or senior management at some point, and you also want to be specialized, or you want to be seen as the go-to expert when it comes to global health or public health or population health. I'm going to do another video to tell you the difference between those in a future Q&A with Q. But if that is the case, then maybe the MSN is for you. However, if you're not interested in teaching nursing students, if you're not interested in, being in administration of some sort, and if you're not interested in academia, that's what I should have said, because the pathway usually for someone that goes to get an MSN in nursing is either academia, or maybe you go on to be a nurse practitioner, you actually see clients. If that's not what you're interested in, then you may lean more heavily toward the Master's in Public Health. And I'd recommend that you actually talk to someone, that you do some more research, that maybe you call a couple of programs, watch some more videos and get a better understanding of just what your career trajectory could be. So speaking of career trajectory, I'm going to share my career with you now. I've done so many things in my career that I actually had to pull up my bio so that I can look at it while I'm giving you this information. But if you're a nurse that's interested in going into public health, I just want to kind of give you an example of what it looks like. One thing that I can say about me, not only do I teach community health workers, which is a frontline member of the public health workforce, but I was a community health worker before I even knew what a community health worker was. Now, in another video, I think I talked about how I started out as a candy striper at a hospital and then a medical assistant. But I didn't talk about my passion for volunteerism. I didn't talk about my involvement with the healthcare ministry at church. I didn't talk about all of the community events that I've planned or participated in, and health fairs I didn't talk about how I've been the president and board of director for 2 nonprofit organizations. I didn't talk about how I was the disaster response nurse leader in Central Arkansas, over 11 counties for the Arkansas Red Cross. And so I say all of this because really, even though nursing, and I do believe that it was a calling, it is a calling for me, I've always had a heart for community. I've always wanted to be where the people were. I've always wanted to be connected to the community side as opposed to the clinical side. And so now when I really think back on it, it makes a lot of sense how I was immediately drawn to public health versus nursing and bedside care. So here are some of the positions that I've worked. So Candy Striper, medical assistant. I got my associates in nursing. I did some moonlighting at a very small hospital in Jacksonville, Arkansas, where I worked in the emergency room. I went to work at the VA full-time for 10 years. I started out there in surgical ICU. I figured out pretty quickly within a year it was not for me. I transitioned to a long-term care kind of rehabilitative progressive unit floor and did that for 3.5 years. And then figured, you know what, I better go back to school and get my bachelor's. I went back and got my bachelor's. And then after getting my bachelor's degree in nursing, I went to go work for an endocrinology clinic. And most of my patients, probably 85% of the patients, had diabetes. And then I fell in love with caring for patients with diabetes, not the disease itself. I never liked endocrinology. I never liked diabetes, but I love the work with the patients. I love health coaching. I love coaching them through that change, which was not an overnight change, right? It took patience and understanding and empathy and all of those things. And that's where I really determined that I had a love, not only for working with the patient, but for working with the wife or the husband or the kids, because diabetes, a lot of times it has to be treated using a whole family approach or a community approach rather, so that you make sure that your client, your patient has the support they need to be successful in any environment that they're in when they leave the clinic. And so this led me really to looking into how can I take care of the public or populations as opposed to one patient at a time. I got my master's in public health, relocated to Houston as the chief nurse of the Houston Health Department. And so I served in a couple of roles there, but primarily I was program manager for a colorectal cancer program, as well as a diabetes, it's called Diabetes Awareness and Wellness Network, but it was a diabetes education center, not outpatient, but it was a community center. I worked there for about 4.5 years, and then I got hired as a diabetes nurse consultant for a state health department. So now I've already mentioned federal employment with the VA, local health department with HHD, and now state health department with Texas DSHS. I worked there for about a year. State health departments is not really my thing, but I did get to learn a lot, and that's where I got the first title of consultant and really felt the need and understood the need to really own exactly what a consultant is and does. The last couple of positions I had before becoming a full-time public health consultant, I was an RN care manager at a federally qualified health center, and then a clinical programs training specialist for a value-based care company. And then I decided, you know what? I've had lots of experience, both on the floor, outside of the clinic, feds, local and state level. And you know, I think I have a really good 360-degree view of healthcare and public health, coupled with all of the experience that I had. Maybe I should just do this myself. And so now I've just celebrated 3 years as the CEO of Umemba Health LLC, which is a public health education and consulting agency. Not going to talk too much about my business on this particular video because it's getting long enough, but you can visit my website, umembahealth.com, to find out more. I hope after hearing more about my experience and, you know, kind of my reasonings and rationales for going into public health, and how it really does complement my skill set as a nurse has really helped you if you're at a pivotal point where you're trying to decide, do I need to get that master's in public health, or should I just go ahead and get that MSN with a concentration in public health? I hope you found this helpful, and I hope you stay tuned to the next episode of Q&A with Q. I'll see you in the next video. Take care.